Fortune 500 consultant, trainer, military veteran, husband and father. Your host, Dr. Aaron Bryant.
And I'm glad you said that because, when I looked at your website, I saw there's a lot of different resources and a lot of it is designed to empower me and support me. So from a veteran's perspective, explain the logic behind that because your program is fairly unique. So explain the logic, explain that purpose behind how you designed this.
So basically the core of the work is, and there's a big difference before pandemic and after pandemic hit.
Yeah, right. Okay.
All the work was in person. So we were limited to the greater Los Angeles area for regular events or regular work, and then covered kind of from Santa Barbara to San Diego out to Imperial County and the desert cities with special events.
Wow.
But in person.
Wow. I'm from LA, so I know how big of a geographic area that is. And for being a bunch of volunteers, I mean, your gas bill must be pretty high.
Oh, yeah. Yeah. I mean, the normal expenses, it's like travel is huge and, program supplies are huge. And then, zero salaries and zero benefits. And I mean, we're very planted.
Wow.
But it's completely clean. It's completely clean.
Wow. That's amazing.
And so the model was basically, the work we do was intended to support people through all of the challenges. So by partnering, I mean, I know, just like you asked me how I got connected to you, just getting to know when you keep showing up at things, you see who's there, who's doing really good work, who's a little shaky, and so knowing the top people at all these different agencies. We don't provide housing, we don't provide employment, we don't provide benefits, a lot of, higher education, a lot of these things we don't provide personally, but we can connect you with the best of the best. And it won't be call this number or go on their website. It'll be, hi, Christine, I have someone who needs this, I'm going to give you their number and I'm giving them your number and, please, be ready for a call. Or after all the big agencies have closed down at 3:00 on a Friday, we can be called. I mean, it's ridiculous. We're not a 24-hour hotline, but weekends, evenings, holidays, someone can reach us and I can go behind the scenes and get someone some emergency help.
Wow.
So with that kind of partnership, what we've been able to do is introduce possibilities. So the bottom line was, when I found what was going on in the veteran community, no one should ever have to feel trapped, stuck at the end of their rope and resort to something unhealthy to ease or end pain or suffering. So how do you do that? You find new possibilities, explore other options. And so we're very outside the box. As you saw, I'll talk about some of those things that we do, but it's like, but how do you explore new things? How do you feel safe enough to push beyond your comfort level? And especially if you're suffering physically, mentally, emotionally, or all of the above, how do you do that? That takes a lot. Right. So developing those skills. So the mindfulness that we're teaching is not meditation. It's not new age spiritual. It's not breathing exercises. It's not relaxation techniques. On the other side of the spectrum, it's not therapy. So we're not doing intakes, diagnosing, treating, prescribing meds, lifestyle, diet, behaviors, or anything. We're basically teaching people, here's some tools that you can use to connect yourself, with another person, with your environment. And the same way situational awareness might have been what kept you alive on the battlefield, this is situational awareness that will keep you alive in the civilian world.
Right.
And you'll get to feel your way through whatever comes at you, whatever's thrown at you from the inside, because a lot of stuff is thrown at us from this, from what other people say, from environmental factors. So if you can navigate, because you can keep your wits about you and make a wise choice rather than default to a knee-jerk reaction and facepalm.
Right, right.
You're going to find your way. You'll be able to find your housing, and you won't be a victim of big emotions. Put your fist through the wall and get kicked out. And you'll be able to choose a wise response to someone at work who's being a jerk. And instead of, punching them, which would be your first inclination, you can keep your job and you don't lose the job. So anything that you want to get, anything that you're aiming towards, you can proceed with strength, dignity, and clarity if you have the tools to do that.
I started to feel like you may knew about my past. I was like, wait a minute, did I mention I did that? Because I've had one or two of those, so yeah.
Well, and who hasn't had something come out of their mouth and just go, oh man.
Yeah, that was
cram it back in, or can we rewind this?
Well, the thing is, I didn't even, I'm a little older than most of our veterans now that are the newest generation. So for me, I wasn't even aware. We didn't have, VA was not like it is now. And we didn't have the abundance of programs. So for me, I went through years and years without even being diagnosed. So I had no idea. I just knew that I just had a lot of challenges going on and I didn't understand. And I had a lot of challenges at work that I was trying to figure out. So it was interesting. So when you said that, it took me back to the incident with one of my old bosses. So yeah, I kind of wish I knew who she was or where she was, so I could apologize, because that wasn't a good look for me.
And that's the thing. I mean, the issues are so common,
Yeah.
And so our model, again, before the pandemic, we'd meet in person, in groups. We've never had our own building or venue or warehouse or anything. So we meet at vet centers, American Legion posts, transitional housing places, churches, Bob Hope Patriotic Hall downtown. We've been on Skid Row for years. So we're out in the community where veterans might be going anyway, or it's a comfortable place to go. And the groups are completely confidential.
Okay.
So we don't take notes. We don't do an intake. We don't ask to see a DD-214. It's all based on, we're offering something, and this is based on some honesty and willingness to kind of really find out what's going on. And so we meet in groups and basically go through 1, 2, 3, maybe 4 practices of mindfulness.
Okay.
And again, people are so relieved that it's not meditation, because for a lot of reasons, meditation isn't comfortable or religiously appropriate or whatever. It's just like,
Yeah. I'm not a fan of meditation either, but I hear it's a good thing to do, but it takes me, I got too much going on up here, too much noise for me to bring it down. And I'm like, what, forget this.
And I love it because so many people interchange mindfulness and meditation. Mindfulness, the definition that we have always used and explained is paying attention to present moment experiences. That can be physical, mental, emotional, interpersonal, environmental. Paying attention to present moment experiences, suspending as much judgment as possible so that we can explore with openness and curiosity. And here's the biggest thing, without trying to fix or change anything. And simply accepting the existence of whatever we find.
Interesting. And that kind of keeps you from crossing that clinical line, correct?
And also it takes the burden off of trying to calm down, quiet this, or think nice thoughts, or be peaceful, or, it's just like, there's a lot of anger inside me. Wow. But, and I don't have to mess with it. I can just go, yeah, I'm angry. And, okay, let's explore it some more. And this is red hot anger. And I can feel it, in my back. And it's just like, explore with openness and curiosity, and just, again, situational awareness, gathering intel. These are all things that people who have served are familiar with.
Wow.
And once you have enough information about what's really going on, and sometimes the more you're sitting with something, it's like, oh, it's actually more like this. I'm noticing that this is really what's surfacing, and you're not having to dig. You're just observing and noticing and seeing, oh, this kind of came to my attention. And you get so much clarity about what's really happening that then you can make a wise choice about what you want to do with it. And that might be nothing. That might be something significant. That might be, I'm just going to sit with it. But what's so amazing about that is you don't have the burden of trying to release tension or relax this or let go of this. Because I don't know how many of us are good at that. I was taking a yoga for veterans class for a while, and the instructor would say, soften your faces. And all that made me want to do was slap her face.
Yeah, I can imagine.
So if I could just go, Gail, soften your face, release your anger, let go of the trauma, I'd be good. I wouldn't be rolling around on the floor with a bunch of other people on mats, But if someone can help me notice and what else is happening, and what else, and what else, and what else, then I'm going to be able to make a wise choice.
Yeah.
And I invariably, with mindfulness, I find that what I might have been striving for kind of happens anyway, without my grabbing for it, because I'm just being present and noticing and being open and curious. And I find that inside and outside, I have a hugely significant number more resources than I thought I did. I am not trapped. I am not stuck. I'm not at the end of my rope. I can try this. I can try this. So as you saw on the website, so while we're learning tools of mindfulness and how to explore our emotions, what's going on in our bodies, what's happening between us and another person, we're also, and again, pre-pandemic, endless excursions, Dodger games, opera, art exhibits, rock concerts, service dog presentations. What else? And because we serve not just veterans, but also active duty Guard Reserve members, all of the family members and caregivers, it's very comprehensive. So we're finding there's a huge support system. I have so many possibilities here. We do wellness areas. It's a pop-up clinic. You get to sample 12 different alternative healing modalities and find, I don't understand what that person did. That was some really weird energy work. I don't have a clue. But the pain I've had in my arm for, 10 years feels better, and I didn't take any painkillers. Okay, maybe I can try this. Or where would I start, with alternative healing modalities? And you find that acupuncture works. You don't know why putting needles in, well, not you do it, but someone puts needles in your ears, why your leg stops hurting you. Doesn't make any sense. But so the work is experiential, and it's all up to you. How does this feel? How did you feel before? How do you feel at the end? Do you want to walk further through that door? You want to try something else? So I love making all these possibilities available, and with a team of people who are also trying them or have tried them and can say, buddy, you won't believe this. It doesn't make any sense, but you've got to try this. Or, two Marines nudging each other during intermission. We can't tell our buddies this, but this opera is actually cool.
They won't say it, admit it out loud, but they actually like it.
Yeah. And just finding, it's just like, this is really something. Mindfulness is not what I thought it was, but it's connecting me to myself and to other things and possibilities. And my kid did mindful arts and crafts, and she's not acting out so much, and we're talking better. Or my wife tried the wellness area, and now has 6 more free acupuncture treatments, and so she's not having to knock herself out with painkillers. And I'm trying that, and you have a whole new world for yourself and your family.